Hello, my friends, and welcome back to the Diverse Thinking, Different Learning podcast. I'm your host, Dr. Karen Wilson, and I am so happy that you are listening today. Today, we are talking about autism assessments. Many parents wonder, what does the assessment process look like? If I suspect that my child might be autistic, how do I know if they need an evaluation? Well, today we are getting answers to some of those questions. Joining me today is Dr. Chandni Singh, a licensed psychologist with over a decade of experience in assessing and supporting neurodivergent individuals. She has worked in medical centers, research programs, and private practice, providing comprehensive assessments for children, adolescents, and young adults. Dr. Singh has a deep commitment to serving culturally and ethnically diverse populations, ensuring that families receive the guidance and support they need. Assessments can feel overwhelming for many families. And today, Dr. Singh will break it down, what signs to look for that indicate an evaluation is needed, what the evaluation process entails, and how families can best navigate their child's diagnosis. This is going to be an incredibly informative conversation, so let's dive in.
Millions of kids struggle with learning, processing, and social emotional difficulties. These challenges interfere with their ability to reach their full potential. Dr. Karen Wilson is here to help. Her extensive background in pediatric neuropsychology and higher education have prepared her for this unique mission. Listen as she delivers content to inform, educate, and empower parents and educators. This will enable you to identify challenges that kids face and get them on the road to achieving their full potential. This is Diverse Thinking, Different Learning by Child Nexus.
Dr. Singh, I'm so glad that you are here.
I'm so happy to be here. Thank you for having me.
Yes, and I've wanted to have you on the podcast for a while, so I'm glad that you said yes. And for a lot of reasons. One, you're just amazing at what you do, but specifically for the purpose of this episode, it's because of your expertise in assessments, particularly when parents have questions about autism. And so, I read your bio, before we started our conversation, and I think it's just so important for parents to know what to expect when they go through that process. So thank you again for being here.
Absolutely. Thank you so much for having me.
Yes, for many autistic children, they get a diagnosis at an early age, often before age 3. But that's not the case for some children and teens. I had a discussion with Dr. Monica Blyde, and the episode was titled, "Why Did I Get Missed?" Right? And when she was talking about late diagnosis of ADHD, but that also happens with autism.
Absolutely, you're right. And in a lot of those cases, I think that the misdiagnosis is essentially a lot of times because, the child may have certain strengths and, when they're younger and going through, when they're younger, they do a lot of developmental screenings, and pediatricians may say, this area might feel a little delayed, but we can wait a little bit longer. Or, there's different case scenarios like that. But what we're seeing is that as the child kind of grows up in the school setting, they're starting to face a lot more challenges, especially when the complexity of the social situation with friendships or navigating how to communicate in the classroom is a lot more than what they're maybe used to in preschool years, right? So then we're starting to get more questions of, hey, something seems not to be connecting as well as we thought, and that's when they start to come in.
Yes. And I love that you describe the differences at an older age and that kind of fits with, when kids do get missed or parents notice something is different. And also because autism can look different in different individuals. And, parents might be looking for early signs and they're just not there. Educators might notice things and think, oh, maybe this is attention, maybe this is anxiety. And there comes a time where parents might consider, or educators might consider, that this might be autism. Are there characteristics, areas where children might be performing or engaging with their peers differently that might suggest that the child or a teen might be autistic.
Absolutely. And, you actually brought up another good point, is that when these questions start to come up, either by teachers or parents, it is very much not all the time are they questioning whether it's autism. They're kind of questioning, is it ADHD? Is it autism? Is it anxiety? Right? So it's kind of under this big umbrella of, there is something going on, but we can't really place our finger on it. So when, we try to define maybe what would be a sign of autism specifically, or symptoms of autism, we also know that there's a huge degree of overlap between all of these different symptoms. So I think when it comes to, for example, your question about, what does it look like in terms of how they're presenting socially? Well, we could kind of define it as a child who experiences anxiety or has ADHD symptoms or has autism symptoms, and their approach to social engagement can kind of look similar and different in various ways, right? But I think at the core of it, what I tend to see is that there is somewhat of a disconnect, and the disconnect can be in different ways. There could be some students where they present as maybe more isolating or more withdrawn, and it takes a lot of encouragement or motivation to kind of help them participate in groups or even interact in one-on-one settings with peers. But on the other end of that, it could be a child who maybe is unaware of certain social cues and may interject themselves a lot into groups and might not know how to navigate quote unquote, typical back and forth interactions with their peers. And so it feels, I guess they get feedback from peers that it's too much, or, I don't know how to respond to this child, right? So I think there can be two ends to that of what parents or teachers are reporting. And at the same time, a lot of parents also, when they start to observe their kids in maybe play dates, or just, when their kids are playing with peers in the playground or at home, they start to observe things like, oh, you know what? Sometimes kids will just say neutral things or offer suggestions for them to help, and they react in really negative ways and think that they're not friends anymore, right? So I think that can also tie into maybe more the child having more of a black and white understanding of certain situations, or misinterpreting those social cues.
And you mentioned before that sometimes we don't see these differences until, again, the social demands start to become more complex, you said, which I think is often the case for children and teens who've kind of flown under the radar and haven't been identified. And when you talk to some of those teens and some of those older children, they'll say that they're, and we've had this conversation on the podcast before, that they're masking a lot of the characteristics associated with autism, is that they learn, but because of the feedback they're getting from their peers, that what they're saying, what they're doing, how they're behaving is inappropriate. And so they change their behavior to mimic those of what we call neurotypical peers, but it doesn't come naturally to them.
Absolutely. And I've also heard a lot of teens talk about how they sometimes go into a shell too of, I'm just not going to attempt to interact because I know it's going to go wrong for me. So I feel safer just kind of minding my own, staying within my comfort zone, which is also sad to hear, because, you want them to feel comfortable and be able to engage in ways that is, positive for them. But they are also, like you said, getting a lot of this negative feedback from peers. And so that then tends to reinforce them being more withdrawn.
Yes. And then that contributes to a low mood. It can lead to depression, and probably contributes to a lot of the anxiety we see in autistic individuals as well.
Yeah.
Because they're trying to navigate these systems that are not set up for them.
Exactly. And then going on top of that, because they're feeling that way, it then impacts their academics. And then they look like students who have learned, like, teachers have concerns about learning delays or something like that. But then when you really dig into it, the source of it comes from something else.
Yes. And many parents who are seeing some of the things that you've been describing might be thinking, I need to know more. Educators might, during a parent-teacher conference, might say, we'd like to learn more about what's getting in the way. And are there indicators that suggest it's time to seek an evaluation? Because I've had a lot of parents who when they come in for an assessment have been thinking about it for a long time, but sometimes it takes a while before they decide, okay, this is important.
Yeah, I don't know if there is a specific time. I do feel like there are different scenarios that can occur that then prompt parents or teachers to recommend testing. I know, I guess, at the higher level of concern, parents might request for an assessment at a point where they're getting just constant feedback from teachers, and maybe these are kids who have more of higher behavioral profiles. So, higher level behavioral profiles. So, maybe being more disruptive in the class, or, just experiencing a lot of difficulties regulating their emotions and behaviors in the classroom. So then that disrupts the, whole classroom dynamic. And so I do have a lot of parents kind of trying to navigate assessments at that point because, they are also feeling stressed and a higher level of anxiety about their child, and getting all these reports from teachers, right? So at that point, they're feeling a little bit like, what do we do next? But I think at the lower end of that, level, it is just having a little bit more awareness. I think you're right. You're right that parents start to observe their children and also listen to their children, maybe reporting some of their concerns. And so at that point, maybe they are, taking initiative to talk to the teacher, kind of getting a sense of what's going on in the classroom. And if the teacher reports concerns about, their general functioning with peers, or, your child comes in and seems a little bit more less motivated, or, they're really struggling with understanding certain communication. And I'm finding that I have to, maybe spend more one-on-one time with them or check in with them. Those are some other, I think, markers where, parents are starting to think, okay, maybe we should check in with someone to see what's going on. And again, not all the time is it necessarily purely autism, but you still want to explore all those different scenarios to see what would be the best kind of supports for the child.
Yes. And what I'm hearing is you're getting input from a number of different sources. So the parents might be noticing something, the teachers might be noticing, and then you're listening to your child because your child is telling you what's uncomfortable, what's working, what's not working. I've had parents who say that there's a lot of resistance to going to school, to interacting with others.
Absolutely.
Perhaps there was an anxiety before, but now it's at a significantly high level, and they want to understand, what is getting in the way of them being their authentic selves with other people, also engaging with the curriculum. All of those things
Absolutely.
are so important.
And actually, a really good thing that you said is that the school refusal, right? So maybe in elementary school, they were like, fine, I'm going to school. I'm really happy. But then mornings become so agonizing, right? To get up and get out the door. And that I think I hear a lot, where my child has now shown a lot more resistance to going to school. And when they come back, they just seem so dysregulated, right? So I think that is a big pattern that we're seeing too.
Yes. So can you walk us through what an assessment would look like when autism is being considered as a possible diagnosis?
Yes. So, if we're considering a gold standard test battery, right, there are a lot of different tools that I think providers will use. But what we typically want to look at is when we're thinking about a comprehensive, looking at a whole picture of a student, we want to really gather information from kind of all aspects of their social, emotional, academic, cognitive profile, right? But when we're looking at core features of autism symptoms specifically, then we're using more specialized tools. So when I'm considering a battery, I often, I guess with all assessments, we often start with doing an interview or an intake interview with the parents just to gather all of that early developmental history up until their current functioning. The developmental history is really important here, right? Because autism is a neurodevelopmental diagnosis. And so we do, even if, at certain ages, right, teenagers, it's hard to kind of recall how they were functioning at 2, 3 years old. But if there's any evidence for any delays or regressions in any of their early developmental skills, I think that's important to kind of review with parents. Now, if they obviously report that there aren't any of those concerns, then we're kind of trying to gather more information about how those skills have developed over the course of their childhood, and where we're seeing maybe strengths and weaknesses across those profiles too. Any relevant medical records or school records, previous assessment history would be helpful too. And then when we dive into the actual, testing tools, we use measures including the ADOS, which is the Autism Diagnostic Observation Schedule. And that assessment is pretty much the gold standard tool that we would use in a standard autism assessment. And what is unique about the ADOS is that unlike, say, an IQ test where, you're doing paper, pencil, sitting at a desk and kind of going through questions, an ADOS is designed specifically to kind of create a space, a social space, where not only the examiner can observe the child interact in different ways, utilizing different types of social-based activities, but there is a free form to it in a way. Of course, we are, as the examiner, we're looking for specific signs and symptoms. But for example, it utilizes some of the modules, and there's different modules based on the child's language abilities and age. But the activities are designed to be a little bit more playful or engage children in different types of conversations or social interactions, so that then we can kind of observe how do they navigate these different nuanced experiences. Are they able to, initiate social interactions with the examiner? Are they able to sustain the interaction if the examiner is, prompting them in different ways or offering certain social bids to see how they react to it? How do they react to humor if the examiner is being playful? Or, things like that. So it does allow for it allows for a better way to observe those social communication aspects of the child, while also kind of looking for, I guess the other part of the autism diagnosis is the restricted and repetitive behaviors. So how are they, utilizing the material, or what are some topics that they're discussing? Are they able to be flexible in the different subjects matter that they're talking about? Or maybe they're just showing interest in one area and they like to talk at length about that, right? So we're just kind of going through the different activities and observing the child in those different scenarios.
And that's such a nice complementary, portion of the assessment to the feedback that you're getting from parents and teachers as well.
Absolutely, because then you see firsthand, right? You're getting someone else's report, which is important. But then, we don't get a lot of opportunities, right, to sit in the classroom outside of maybe a brief observation in a classroom period. So it does give us a little bit of a more natural way to observe their interaction style.
Hello, I'm going to take a short break to tell you about one of our Child Nexus partners, Westmark School. Boost brain power this summer at Westmark School. Applications opened on February 1st for Summer Smarts 2025, Greater LA's leading summertime academic program for students with dyslexia and other language-based learning differences. Serving grades 1 to 12, Summer Smarts offers daily reading, writing, and math intervention, plus art selectives and a new pathway for aspiring high school entrepreneurs. Learn more at westmarkschool.org. Now back to our conversation. That one-on-one is so important because it's so valuable because you, like you're saying, you see firsthand the interactions, the social interactions. And then in addition to the ADOS, you're also giving other measures that help kind of rule out other reasons why a child might be struggling in their school environment or at home.
Absolutely. And, the ADOS, I think, is a great tool. And because it is so dynamic in that sense, it doesn't just rely on an interview or, something like that, but it does include things like a child-based interview in there where you're talking to the child about their relationships, friendships, social difficulties, their emotions, right? So it ties in a lot of that, and it provides the examiner with a better understanding of the child's insight into those different things too, which is really important in all of this. Because yes, on one hand, it's important to get the teacher's perspective and the parents' observations, but we really want to hear from these teens about their personal experiences and how they understand their social world.
Yes, and they share so much about what their daily experience is like, and they're able to tell you firsthand what is problematic for them, what's difficult for them. And it's wonderful. I mean, I've watched you give the ADOS, and you get such rich information just from watching you administer and watching the dynamics between you and the child or the teen.
Yeah. And you know what? I will say that obviously not all the time, because they are teens. So not all the time are they really comfortable sharing everything. But it is a great tool because, you don't jump into that interview. You're actually doing a lot of these other play-based activities to kind of, gradually help them become more comfortable with you, because you're acting silly and talking about these different things. And maybe you're offering personal experiences. So it does set the tone for them, hopefully, to feel a little bit more comfortable sharing more about themselves.
Right. And we know that autism often coexists with other behaviors, conditions like ADHD, anxiety, or sensory processing challenges. Does an assessment determine whether a child has multiple diagnoses? I know that's something that the parents often ask when they're considering an assessment.
Yeah, absolutely. So I mentioned the parent interview and the ADOS, but there are other measures that we can also utilize within that test battery. Of course, we always want to look at a cognitive assessment, essentially an IQ test, not necessarily because we want to know the child's IQ, but that test gives us some additional information about their different areas of their cognitive functioning, right? So whether that's looking at their working memory, short-term memory, their processing speed, their visual spatial skills, their verbal comprehension. It's a great way to kind of define their profile of strengths and areas that they are still developing, and how that also impacts the way that they are learning and understanding information. And on top of that, we might use additional tools like looking at their adaptive functioning, looking at their social emotional functioning through their own either self-report rating scales or with the parents and teacher rating scales. So we can see, what are some other areas of concern that are coming up for them, whether that's mood related, right? Internalizing depression or anxiety. Are they reporting concerns? Are teachers and parents reporting concerns about difficulties with focus or concentration in the classroom, right? Are they particularly fidgety kids? So all of those types of, I think, characteristics come out in a more comprehensive evaluation. And so when we're looking through all of that data, it helps us to kind of formulate a better understanding of are all of these concerns best explained through a diagnosis of autism, or are there other things that could be contributing?
Yes. And as you're describing the process, I think it should be clear to people listening that the parents are involved very much so in the assessment process. It's not, and I often think of the assessment as not as something that you're doing to a child. It's something you're doing with the family, right? And the parents are playing such an important role in helping us to figure out a child's strengths and areas where they might need more support.
Yes. And, I'm bringing this up because I had a conversation with a family recently, but another important aspect of this, and I know you also highlight this in your work with parents, is that outside of just learning about their school, social setting and things like that, the family's ethnic background, their culture, their family values, the way, I think that is also informative. And parents often say, well, I come from this background and this is why my parenting style is like this, or this is my understanding of autism based on, my how I grew up. And so I think that is also important to highlight for them, is that the way when we think about interventions or recommendations for support and interventions and how to, support parents in navigating certain behaviors or in supporting their kids and in improving, whatever it is that they have concerns about, it's important to kind of have that foundational understanding of their family values and how, they would approach certain situations, because when we are recommending things, we want to make sure it's also aligned with that and supports that understanding too.
Yes. And we also see that cultural differences might impact how they perceive their child's behavior, and as parents, but also extended family, grandparents, other people who might be involved in the child's experience, depending on the school that they go to. Cultural differences might also impact how they're perceived by others and how they feel that they're being perceived by others as well. There's so many factors to consider.
Absolutely. And how is this diagnosis going to be understood by different family members, or how are we going to navigate communicating this with his school providers or the culture of the school that we're feeling uncomfortable with, or, things like that. I think we try to be more mindful of, because it's a piece of this puzzle too, is that, okay, fine, we confirm something for you, but then what happens next? How do we navigate all of this?
Yes. And I think there's still some fear from parents about a diagnosis, regardless of whether it's ADHD, autism, or dyslexia or something else. But I feel like things are changing. I know that we have a neurodiversity affirming approach and understand that many systems, like I was saying before, are just not set up to support diverse learners or diverse thinkers. But it feels like there's a shift in society's understanding and acceptance of learning and thinking differences, which might be leading to an increase in people seeking these assessments.
I agree. And, and even just working with some of these kids in the different schools that we work with, they tell you, the students will tell you, my school does have a lot of presentations about neurodivergence, and there's signs all over our school that, present us with this type of information. And they're finding more community, regardless of a diagnosis, they're finding more community within this kind of neurodivergent population. So you're absolutely right. I think both parents, students, and all across the board, parents, students, and teachers are definitely showing a lot more awareness in that area, which is really great to see. And I do think parents, but I feel like years ago, parents would come in feeling a lot more, nervous. But now I think there's a little bit more of a, hey, I'm hearing a lot more information about this, and I want to check it out for my child. And they feel a little bit more, I don't know if I would say confident, but just a little bit more okay about going through the process.
Yes. And I feel like the language has changed and shifted in such a positive and beautiful way as well. We're not pathologizing a lot of the things that we see. We're talking about differences in communication. We're talking about, autistic individuals having these hyper-connected brains, which make them feel more intensely or more passionately about things that they love. We talk about routines and structures that provide people with comfort. And so I think the language has shifted as well to support that view.
Absolutely. It's not, viewed as this disability. It's more of a, let's, focus on these areas that we can further support our child, to function in the way that they feel most comfortable, and provide that setting that is going to be to motivate them best.
Yes, that's exactly it. And what you're saying, and I always say, is that the purpose of an assessment is not to get a diagnosis. Even though, parents have to submit super bills and they need a diagnosis, that's just the way the system is set up. But from the family's perspective, they want information. They want to better understand their child. They want to better understand how they can support the people that they love so that they can thrive at home, at school, and in their communities.
Absolutely. You're absolutely right. And their perspective too, and a lot of them do come in saying, we're not really searching for a diagnosis. And I'm sure you hear that a lot too. And so I do agree that they come in, concerned for their child, clearly, and just wanting to know how best to provide them with that, support system so that they can thrive.
And if a child receives an autism diagnosis or determined during the course of the assessment that the child is autistic, the teen is autistic, what are some of the next steps for families? And I know it's going to differ depending on the age of the child, where they're in school, what the family dynamics are, but what are some things that parents can expect from the assessment process?
Yeah, you're absolutely right that it would depend on, the different symptom profiles. But, at the core of it, we're just really looking at how to provide a comprehensive support system here. And so providing recommendations, not just for school, but home and within the community setting. I think one of the kind of, most important thing is to, if there is some, anxiety or depression or mood related concerns there, on top of them, trying to navigate their understanding of social interactions and relationships, then we really want to help them find a therapist that would be, a good fit for them. A lot of times we are recommending therapists who have worked with, other neurodivergent teens. So they have that kind of background and understanding of how they might communicate or understand or have a level of insight that is maybe a little bit more, just have more familiarity with that, working with that population. We often do tell parents that, while it's important to kind of see what the best fit is for your child, and sometimes it is a little bit of a trial and error to find the best fit as far as a therapist, we always recommend, cognitive behavioral therapy or a therapist who kind of has a foundation in CBT methods, because those methods are a lot more focused on skills-based supports, which we find is most effective for these students, right? They want to kind of learn about different strategies and then be able to kind of practice that in sessions and then how to generalize that into their life. And so we find that a CBT approach is often the most effective. But also, we also see a lot of kids benefiting from not just CBT approaches, but more mindfulness-based approaches too, whether that's through like some kind of integrated dialectical behavioral therapy or just general strategies on how to regulate themselves, right? They're experiencing a lot of overstimulation and for various reasons, whether it's, sensory aspects of their environment or feeling, like we talked about earlier, having to camouflage a lot of things. And so they don't have an outlet to kind of express themselves the way that they want. So we do find that having strategies that help them to kind of regulate their mind body a little bit better is helpful too. As far as other recommendations, I do think one thing that I think comes up a lot is parents ask about medication. Of course, as a psychologist, I often say that, it's best to consult with a medical provider. But I also tell parents that not autism is different than ADHD in the sense that ADHD has a lot of research behind it that, does indicate that medication plus therapy is often, an ideal support for certain students. But for autism, we don't really have specific indicators that say there's this one medication that can help with these symptoms, right? So we really want to, if there's questions about that, of course, you should always, we always recommend talking to their medical provider, but at the same time, just really working on therapeutic tools and supports in the child's environment, I think is most important.
Right. And that support in their environment can be accommodations. It can be, I know that social skills, oftentimes young people, are eager to, you talked about skill building, to know the skills about how do you enter a group? How do you problem solve when you have a disagreement with a peer because they've had these negative experiences and they want to learn those strategies as well.
Absolutely. And, a lot of school systems do have kind of a social skills group or some kind of intervention that they can support the child with, but some schools don't. And so then, that the other recommendation would be to seek out social skills settings in different clinics and things like that I think could be helpful. Sometimes with teens too, I know there's a lot of clinics that have like teen support groups and things like that where they feel a little bit more, comfortable because they are amongst their peers and they're talking about different things that they're all going through that is like kind of a shared experience, right? So sometimes that can be helpful too. And within the classroom setting, I think it's also just like you mentioned before, just a lot more communication, right, between teachers and parents and kind of navigating like what within the classroom can be most helpful to my child, whether, it's providing accommodations for their seating, their chair or their desk or where they're seating in the classroom is. Are they feeling overstimulated or feeling a lot of sensory overload from certain lighting or, I don't know, more talkative students or, things like that. Whatever, as much information as we can get from the student of what might be impacting their learning, then we can start to integrate certain accommodations within that setting. Fidgets, right? A lot of schools are allowing nowadays for kids to have fidgets and something to help them, again, regulate.
Yes. Yes. I mean, all of this information is so helpful for parents who are kind of just embarking on this journey or are questioning whether or not this would be, a next step for them, for their family to better understand their child or teen. But I think it's so good to hear that, the benefits of an assessment process is really having this information to help you better understand your child and your teen and to help them better understand themselves, because it can create a lot of anxiety not knowing, why is this so hard for me? Right?
Yeah. Yes, absolutely. And it also, I think it helps, and so for some families, it also helps in some ways builds a better communication system, because I think before the assessment, parents are, obviously struggling with how do I show my kid that I'm here for them and I'm trying to understand them. But then going through this process, at the end of it, it gives them this kind of open door to, hey, like these are, you should, for the kid, it's their parents showing them, hey, we really wanted to better understand you. And now we have all this information and ways to help. And then for the parents, they're feeling a lot more reassurance of just having a little bit more guidance on how to, not only help their kid function in school, but help their relationship with their child, right? And ease some of that stress on both ends for the child and the parents. So I think altogether, the hope is that even as anxiety provoking as an assessment can be for obvious reasons, the hope is that at the end of it, they are feeling a little bit more resolved and taking the next steps.
Yes. Dr. Singh, this conversation has been so valuable. And I know, these are questions that we get asked all the time by parents who are seeking, considering an assessment. So for parents listening who have concerns about their child's development, about struggles they might be experiencing at home, at school, on the playground, if they want to know more, how can they get in touch with you to learn more about the assessment process?
Yes, absolutely. Well, you can definitely provide them with my email. And do you want me to give the actual email?
Yes, sure.
Okay. So that would be my full name. So Chandni Singh, ChandniSingh, PSYD, PSYD@gmail.com. They can use that email, or they can use, I have another email for them. The other email is Dr. Chandni Singh @westlaneuro.com.
Wonderful. And I will put a link to both of those email addresses in the show notes. Thank you again for being here. And I'm so glad that we've been able to have this conversation, but also even more important is that we get to continue to have opportunities to work together.
Absolutely. I'm so looking forward to that. And thank you so much for having me. I love having these discussions and not just talking about what I know, but learning from other providers. So I appreciate you taking the time to have me on your podcast.
My friends, I hope you found this episode helpful. And if you did, please share it with other parents and educators who might benefit from this information. And as always, don't forget to check out the show notes for additional resources and related episodes. Thank you for joining us, and we'll see you next time.
Thanks for listening to Diverse Thinking, Different Learning by Child Nexus. For more resources, visit us online at childnexus.com.